Your doctor either loves your Medicare Advantage plan or they hate it. But here's what they're not explaining: how often prior authorizations actually happen. Most people know they exist. What catches them off guard is how often it happens. MRIs, surgeries, physical therapy, even some prescriptions. The list is longer than most people expect. I'm breaking down which services gets delayed and what to expect when it happens, so you're not caught off guard when you need care. If you want Medicare explained clearly, I post twice a week. So here's how it plays out. Your doctor orders a test, you assume it's scheduled, then the billing department calls and says it's waiting on approval. CT scans, some outpatient procedures, home health, they all go through review before you get on the schedule. The insurance company decides if it's approved, when it moves forward, and sometimes whether you need something else first. And that middle step is where most frustration starts. But here's the other issue. Even if you get approved, there's no guarantee your doctor will still be in network next month. Networks move more than people think. A doctor who's in your network today could leave in the middle of the year. Contracts change often, hospitals shift networks, and no one warns you ahead of time. When a doctor drops out, you either switch or you pay out of network rates, which could be more money out of your pocket. And it hits fast when care comes up. You probably think your doctor will warn you. But doctors aren't licensed to tell you which Medicare plan fits you. Compliance rules keep them neutral even when they want to say more. And most staff rely on quick plan materials dropped off by sales reps instead of full comparisons. And there is never enough time in a short visit to go through drug tiers, pharmacy rules, and yearly changes. From where I sit, this is why people leave with good medical advice, but no Medicare clarity. You're the one comparing plans, which means you need a clear checklist to follow. Here's what to look for when you're doing that comparison. And let's be honest, perks get all the attention: dental, vision. But the part that protects you is the out-of-pocket limit. It's the most you'll pay in a bad health year. And in 2025, that number ranges from $2,000 to over $8,000, depending on your county and the plan you pick. Say you need heart surgery, hospital stay, imaging, rehab, follow-up appointments. With a $3,000 limit, you stop paying once you hit that $3,000. With an $8,000 limit, you're on the hook for $5,000 more before your plan takes over. Bottom line, check the out-of-pocket limit first. Extras come second. Now here's how these rules actually affect you once you're using the plan. Imaging gets delayed, surgeries get pushed into review, and drug costs jump when the formulary changes. A medication that was $10 in January might be $100 in July. This is what I hear every day. People don't see the problems until they're already in the plan. That's why I break this down, so you see it coming before you're stuck in it. Let me give you a quick example. Someone reached out to me because their doctor ordered a CT scan for some chest pressure. He thought it would be scheduled right away, then the plan paused everything for prior authorization. He said to me, "I don't get it. My doctor already said I need this." I explained the plan has to review certain tests first, even when the doctor's on board. Prior authorization usually takes 3 to 7 business days. The scan got approved, but that wait changed how he evaluated plans going forward. Now you know what most people don't figure out until after they enroll. Plans control approvals through prior authorization. Networks can change anytime, and the out-of-pocket limit matters more than the perks. So when you're comparing plans, start with networks, drug coverage, and that out-of-pocket number. Then look at extras. If you're already enrolled, use the next enrollment window to verify your doctors are still in network and your prescriptions are still covered. If this helped, share it with someone planning for Medicare. Drop your questions in the comments. I read them all. And if you want a simple checklist you can actually use, grab the free Medicare Starter Kit in the description. And follow along. I post twice a week.